Welcome back to Physio Vibes. In this video we are going to look at
cervical rib and physiotherapy management.
Before we start, hit the subscribe button for more videos. Press the bell icon and never miss another update.
Cervical rib and physiotherapy management. This is an additional rib which arises from the 7th cervical vertebra. It is usually attached to the first rib close to the insertion of the scalenus anterior muscle. It is present in less than 0.5% of the population. The cervical rib is usually unilateral and is more common on the right side. It is diagnosed in the middle-aged group persons, though is present since birth. The cause is that by middle age, the shoulders start drooping, which causes the cervical rib to get depressed. Clinical features. Local symptoms. There is often a tender supraclavicular lump which is bony, hard and fixed when palpated. Sensory symptoms. Tingling in hands or fingers. Can find either to radial side or ulnar side, or sometimes involve even whole hand. Motor symptoms. Loss of gripping power of hand. Tendency of dropping the things from the hand. Wasting of palmar muscles. Either thenar or hypothenar or interossei muscles. Vascular symptoms. Cold, clumsy extremities, particularly fingers. Skin color changes to blue associated with trophic changes. There is risk of gas gangrene. Radial pulse becomes feeble or may even be absent. Types. 4 varieties are described. Complete. The cervical rib reaches up to the first thoracic rib. Bulbous end. In this, the cervical rib has a bulbous end. Tapering end. In this, the cervical rib tapers. Fibrous band. In this, the rib is represented by a thick fibrous band. Pathological anatomy. The neurovascular structures, the brachial plexus and subclavial vessels are hung up by the cervical rib that is inserted into the scalene tubercle of the first rib space. Pronounced drooping of the shoulder in women after middle age, trauma, unusual lifting operations. Acute illness make the muscles weak, pulling the plexus and artery distally, giving rise to symptoms. Radiograph. X-ray of the neck AP and lateral views helps to detect the presence of cervical rib. However, the absence of the rib on the X-ray does not rule out the possibility of the presence of cervical rib. Treatment. In mild cases, sling exercises often help. In more severe cases, scalenotomy, resection of scalenus anterior muscle, may be required and is successful. In troublesome cases, removal of the cervical rib or the first rib surgically with its periosteum to prevent its regeneration is advocated. Physiotherapy measures for cervical rib. 1. Thermotherapy for pain relief relaxation. 2. Correction of posture by postural guidance. 3. Exercises to improve distal circulation of hand fingers. 4. Exercises to improve tone, power, endurance of whole arm small muscles in hand particularly. 5. Strengthening exercises for all shoulder joint muscles. Self-resisted strengthening exercises for shoulder elevation adduction muscles. 6. Progressive resistance exercise for shoulder girdle with weight belt.
Thanks for watching. Don't forget like, share and subscribe.